Well, let us talk about some special circumstances of overactivity of the bladder. And when do these happen? So one is nighttime bedwetting. Now, it's not uncommon in young children, but could also happen in the adults. And there's bedwetting. They don't have any other complaints. The only complaint is bedwetting. And the drug of choice is imipramine. And once I know the history, we look at your voiding diaries. There are several things that we take care of. And once that is done, then we can put you on imipramine, which is very effective. Nighttime frequency is the other problem. Now that also can be managed with a medication called desmopressin, which decreases the amount of urine production at night. But you've got to watch for water holding back and low sodium. So we keep a watch on the sodium, but that's a good medication to work with. Now, one situation when you may have nighttime frequency is OSA, obstructive sleep apnea, meaning snoring that is causing sleep apnea. It means you are obstructing. When that happens, it increases your belly pressure because you're struggling, so the belly pressure goes up. Number two, there is a release of a hormone from the heart that makes the kidney push out more urine, and it wakes you up. So you're waking up too. So that is why your nighttime frequency goes up if you have sleep apnea. And the treatment for choice for sleep apnea is a CPAP machine. And the moment you get a CPAP machine, your nighttime frequency gets much, much better. Leg swelling. That is another problem. You may walk around in the day, you don't realize that leg swelling is there. You lay down, that fluid comes back into the heart, and heart kicks it out, and now you're getting up at night to go to the bathroom. So in the evening, a good idea is to do leg elevation, application of stockings, avoid fluids after 7 p.m., and check with a medical doctor as to why am I getting this leg swelling. So remember, there are many of these medical conditions that can result in bladder changes. Prolapse is one. So when the bladder is coming down and is falling out, that kinks that urethra, the bladder is not emptying, and now you're going more frequently to the bathroom because you're trying to empty a bladder that doesn't want to empty because of this urethral kinking. Once you put the bladder in and the urethra becomes straight, it's emptying well, and then there is no problem with frequency. Or, as I mentioned earlier, a fibroid pressing on the bladder. So if it's really pressing hard, there's a pubic bone in the front, the fiber at the back caught between a rock and a hard place, so as to speak. Now the bladder has nowhere to go, and therefore your frequency goes up. We take off this thing and your frequency gets better. Diverticulum also. So diverticulum is like an outpouching, like the colon. This is the urethra. This is the bladder. This is the urethra. This is like a pouch there. So when the urine comes out, sometimes it'll sit up here. And then when you stand up, it dribbles out and dribbles out. Or it can cause a bladder infection. And that itself can be responsible for a different type of urine leakage, especially if it causes an infection. Bladder infection clearly causes increased frequency, urgency, and overactivity of the bladder. So all these conditions are specific conditions that have to be taken care of individually. And that's why a proper history, proper examination is important. And that's where we come into play. As urogynecologists, we are very comfortable doing a vaginal examination, and we know and can identify any abnormal pathology in the pelvis, like a fibroid, an ovarian cyst that could be pressing on the bladder, or a prolapse that's happening. So we could identify. We're not really sitting across the table from you and giving you a medication. So once we do the whole evaluation and examination and rule out these conditions, that is why the compliance of a patient following up with us is much, much higher. We want to therefore drop this down 70%. So remember, the patient's bothered by this. Can this be changed? So how do we make a dent in this non-compliance rate? What we'll be talking about is what are the next steps and what do we do?